Hello, everyone, and welcome to Biohackers Lab. I'm your host, Gary Kerwin, and on today's episode, I have Dr. Ron Ehrlich. Dr. Ron is one of Australia's leading holistic health advocates. He has over 35 years of clinical practice as a holistic dentist. He also currently serves as president of the Australian College of Nutritional and Environmental Medicine, is a co-founder of the non-profit organization Nourishing Australia, and is the author of the book, A Life Less Stressed, The 5 Pillars of Health and Wellness. Dr. Ron, thanks so much for coming on for an episode for today.
Thanks, Gary. I'm glad to be here.
Yeah, so I was saying to you off air there how there are so many topics we could talk about. I mean, especially with your book talking about stress and the different aspects of stress that you look at in there. But there's one particular topic I thought that would be really interesting for people today is your personal story and your story of having a diagnosis of prostate cancer and how you've had to deal with that and how you managed to cope with the stress of prostate cancer itself. So if you wouldn't mind just introducing people then, what is the story behind that diagnosis?
Well, thanks, Gary. Writing a book like this, A Life Less Stressed, I have to almost always preface it by saying this is not autobiographical, it's aspirational. For me, now more than ever, although in a sense it was autobiographical because it kind of traced what I had been interested in for the last 35 or 40 years of my professional life. But when I turned 60, I'm now 64, when I turned 60, I did get a diagnosis of prostate cancer, and it didn't come as a huge shock to me, I must admit, because my brother had it when he was 60, my father had it when he was 60, my uncle had it when he was 60, and he actually died of it. So when I turned 60, I was very keen to get a to establish whether I had prostate cancer or not. And I had a newfound respect for family histories. As a practitioner, we're always taking family histories and, do you have any history of this or that? And kind of note that down very quickly in a bullet point. But actually, it's far more than a bullet point. Family history does count. So I had an examination by my GP and a PSA taken, and it was very low. They couldn't detect anything. I then went to see a urologist because of the GP said, we should maybe explore it further. So I did, and I went to the urologist, and similarly, he couldn't feel anything. And my PSA, for men, PSA, prostate stimulating androgen, my PSA was 3.2, which is quite low, I think. And then my urologist suggested I have an MRI. And if the MRI had come back with just one or two discrete areas, I don't think I would have gone any further, because there are many cases where prostate cancer, people can live into old age with prostate cancer. But there were many areas in my prostate that showed up on an MRI. So I did have a biopsy done, and that's no small thing either. That's not something to rush into. But with these various areas on my prostate, I decided to have a biopsy. And when you have a biopsy, they do what is called the Gleason rating, which indicates how virulent it is. And 6 and below is not really. 6 is not too bad. 7 is maybe hold and watch and wait, and 8, 9, and 10, is definitely operate. And mine was around 7.5 to 8. So I ended up having a radical prostatectomy, which was quite challenging. As an operation, it is challenging because it creates all sorts of issues around incontinence, and there are all sorts of issues around sexual dysfunction. So, this began a journey of a few months of recovery, and fortunately, I have made an almost full recovery. I would say I'm back to about 90%, and certainly knew I had an enlarged prostate before, which was affecting urinary function, and now I'm back to where I was in my 20s and 30s on that score. So the logistics of it all, but it was very interesting being a patient in that system, and it's always interesting as a practitioner suddenly being on the other side as a patient. Now, as a dentist, we're all patients. Every dentist is a patient. But of course, not every doctor, not every surgeon is a patient. And so to enter the system is an interesting one. in itself, because it's very, as we've come to expect of our Western medical system, which I am eternally grateful for. I'm not being critical of, but it is essentially a chronic disease management system, and it deals with the issue at hand, and very little else is offered in terms of any of the things that I actually cover, or very many of the things that I cover in my book. So I took a couple of months. I took a couple of months off just to recover, and during that time, I thought to myself, because I really had to rest, that I'd write a book, and that was the stimulus for writing my book, actually, because I could sit down for 5 or 6, as it turned out, 6 or 7 days a week for about 3 months and write, and it was a very cathartic experience, because now what I was writing about became even more important to me in terms of what I would do. I mean, when you look at the statistics of cancer, 1 in 2 men, 1 in 3 women will contract cancer by the age of 60. So I knew plenty of 60-year-old men, some of which had cancer and some of which didn't. So in a sense, I took a hit for the team. I was one of the 2 in that statistic. So it didn't come as a huge surprise to me. And when we're often told it's because we're getting older that we're getting all this cancer, although I don't consider 60 to be older. And when you look at the statistics, kids' cancer is on the rise as well, and they're not getting older; they're still kids. So we do have a problem, and so that began. Well, it didn't begin my journey, because actually, when you do even more statistics, and this was a very interesting study that I stumbled across in my research, was a US labour study looking at the 950 worst jobs, or 950 jobs in America, and on the criteria of 6 criteria, I think there were, some of which were exposure to toxins, exposure to microbes, being seated, exposure to radiation. There were 1 or 2 other criteria, and they scored each profession on those 6 criteria. And some of those professions, as you can imagine, were really, they were everything, 950. I mean, you've got refinery workers, garbage collectors, you name it. And when it came down to who was number 1, 2, and 3, it turns out that dentistry scores very highly on that. A dental hygienist is number 1, a dentist number 2, and a dental assistant number 3. So there was that. Dentistry is a very stressful profession. I knew that. I've got my own podcast, and I've done various episodes on, for example, vitamin D. I'd never had my vitamin D levels checked. About 5 or 6 years ago, I did a podcast on it. Went and had it checked, and my vitamin D levels were at 30. Now, normal is somewhere between 50 and 100, and if you've got cancer, 120. And I was not doing anything different in the last 20 or 30 years. I looked actually tanned. So there I was, vitamin D deficient. Then I did another program on MTHFR, which is a methylation gene. So a very important process the body goes through is taking nutrients and methylating them, or making them available to be used, called bioavailability. Turns out I have 2 genes which don't allow methylations. And so, I wasn't methylating my vitamin B particularly. And so there's another one. Every time I did another podcast, I checked myself out. I did another podcast on men's health and testosterone levels. We all have our blood tests done, and also our doctor orders it, but I've never had the testosterone levels checked. Thankfully, my testosterone levels weren't too bad. But there was so much there that my profession, my family history, vitamin D is thought of as the cancer vitamin, so it's been low for probably all of my life. And I live in Australia. You would think, here I am out in the land of the sun, but I spend an awful lot of time in my surgery. So, I'm not out in the sun enough, clearly, or absorbing it for that matter. So there were a whole range of issues which emerged. And then it actually was very sobering to have these conversations with some of my male patients. And that opened up a whole new world to me of other people's experience, as well as my own family's experience. And it's a really common male cancer, prostate cancer. and how you approach it after you've been diagnosed is really important. For many people, it's obviously a life-changing experience, but many people, I mean, I would rather never have had a diagnosis, but I'm an eternal optimist. And so I think there are things about a diagnosis which can be life-altering and alert you to the fact that, hey, this is getting serious now. It's not just theoretical, it's getting serious. So a lot of what I talk about in my book is really important to me, particularly, and that's why I say the book is aspirational now more than ever.
Yeah, and I think exactly what you said there with the diagnosis being different, life-changing. Your story is a little bit different because you were looking for the prostate cancer, whereas it may come as a huge surprise to a lot of people who just didn't see it coming at all.
Yeah.
And so did you still, it sounds like you didn't have maybe the first question I think a lot of cancer patients have, which is the why question. Why me? Why did I get it?
Yes, well, there's another story there too. And I mean, really, as I say, the book involves an exploration of the 5 stresses in life that can break us down or compromise our immune system, and the 5 pillars of health that can build resilience. And this is all about balance. We live in a real world. So the 5 stressors are emotional, environmental, postural, nutritional, and dental stress. That's been a model of health that I've been using in my practice for the last 35 years. So when I explore each of those, and I'm particularly interested in nutritional and environmental medicine, I've got a fellowship in nutritional environmental medicine. I got that about 20 or more years ago. And I'm also obviously interested in dental stress, and we can talk about what that is. And I'm also interested in postural stress. Now, in that stress model, I never really felt comfortable talking to my patients about emotional stress. That's not my specialty. I'm specializing in dental stress. That's what I do. But I've been aware of all of these stressors for a very long time, and I've explored them professionally, personally. And so not only was there a family history there, but it didn't come as a shock to me. In fact, when you look at, for example, the environmental stressors that we are now all exposed to, the question isn't, are you exposed to an environmental toxin? Are you exposed to potentially harmful radiation? That's not the question for us anymore. The question is, we are all exposed. To what extent does it affect you as an individual? Now, there are literally tens of thousands of chemicals that we are exposed to on a daily basis. And we assume, and as you walk your way up and down the aisles of the supermarket and look at all the labeling on all the packages, you would just assume that all these chemicals have been approved and they've gone through all this rigorous testing, and that's why they're on the shelf. But actually, when you know the real story, that is simply not the case. I mean, maybe 5%, maybe 10% of all the chemicals, and I'm saying tens of thousands of chemicals that we're exposed to, have gone through any rigorous testing. And by rigorous testing, the way these are typically tested are a chemical is tested on a student usually over a short period, 6, 8 weeks, 3 months maybe, one chemical at a time. Well, that's just simply not the way we are exposed to chemicals. Chemical toxicity is about synergy, not an arithmetic, 1 plus 1. If I gave mercury, for example, a toxicity value of 1 and lead a toxicity value of 1, in toxicity terms and environmental toxin terms, 1 plus 1 does not equal 2. 1 plus 1, when it's combined in the human body, can equal 10. So when you look at the synergistic effect of all the chemicals we're exposed to, and then you combine that with the Wi-Fi radiation, which is all pervasive, and I'm not sure what it is happening in the UK, but in Australia, 5G is just around the corner, and that is of real concern. In 2011, the World Health Organization classified Wi-Fi radiation as a Class 2B carcinogen, which means that it is a possible carcinogen. Class 2A is a probable carcinogen, and class 1 is a carcinogen. So Wi-Fi radiation has been known since 2011 to be that. So when I look at all the toxins that we're exposed to, my surprise wasn't that I got it, particularly given my family history. My surprise is when I hear people don't have it. That is a testament to the human body and its resilience.
Yeah, and I guess I think probably the next journey did you have also, it sounds like you went straight for the radical option with the surgery there to remove things. Did you even consider trying to not have the surgery? I mean, some people are going to be in that dilemma, where they'll try to look for alternative sort of solutions. With yourself, with your background and your knowledge base, did you know for you that is the best solution straight away?
Well, it was really difficult one, and every person is an individual. So every person needs to make that choice individually. And there was quite a complex. I mean, I looked at the MRI and I saw its proximity. Now, a prostate is about the size of a walnut, and it wraps around the urethra. So, and it's covered by nerves which supply our sexual organs, right? So, this is when I had the MRI taken, the cancer had been very close to the capsule of the prostate. And as I said, if it had just been a little more discreet, I don't think, I shouldn't say definite, but I don't think that would have been the way I would have gone. But I do other things as well. I did other things as well. And one of the first things that I did, and I had already been on this journey, was I reduced my carbohydrate level considerably. I think, when you go, one of the things that you do when you have a cancer is you go and have a PET scan to check whether the cancer has spread. And a PET scan injects radioactive glucose into your body because the medical profession know very well that cancer cells prefer glucose. That is their fuel. And if you lie still for 10 minutes so that the glucose doesn't go to your muscles, it will then go to whatever organs or where the cancer is. And I was very concerned because of past family history that the cancer would have spread to my pelvis or to the surrounding lymph nodes. My uncle, as I said, had died of this. My father had it. My brother had it. And I was aware that complications could occur within the surgery, and they can. I mean, nerve damage is a significant side effect of prostate cancer, and it raises a whole issue around sexual dysfunction, erectile dysfunction. So this is not. And when you are confronted with that as a male, as a male or female in a relationship, you realise how penis-centric, sexual relationships can become. And so, this is a very complicated issue. I was aware of a whole range of things that I could do. I was very aware of, for example, the Ornish program. Dean Ornish did some excellent research on this and found that on a vegetarian diet and meditation and group therapy to talk about these things, you could get some significant improvements. And I explored those things as well. This is not an all or none thing. You don't make a choice. I don't believe you make a choice to go down this path or that path. And if you're expecting the radical path to then support you through the alternate things that are available to you, you're going to be very, very disappointed. The profession are very dismissive, not dismissive, but not very supportive of it. Oh, it's sort of patronising, like, yeah, look, sure, if you want to try going on a diet, do that. If you want to look at your blood chemistry and check your vitamins and mineral levels, sure, do that, try that. Meditation, yeah, I'm sure it's good for us. So the medical profession are very dismissive of that as a rule. And it's a shame, because when you combine the two, you can get some very good results. And it's why I think a lot of people view their diagnosis of cancer as being life-altering in a very positive way. I know that sounds odd. Everybody would rather not have a diagnosis. But when you are faced with it, you can either throw your hands up and be shocked by it all and fall into the arms of the medical profession with their chemo and their surgery and their radiation and kill, slash and burn everything. And I think there is a place for that. But there is also a place for supporting the immune system. And nutrition is a really interesting example. I go back to the PET scan. Excuse me, Gary. The PET scan injects radioactive glucose. So the medical profession accepts its diagnostic value. They accept the fact that cancer likes glucose. So would you not think that a logical progression from that would be, why don't we stop feeding the cancer and avoid glucose or carbohydrates, which quickly can break down to glucose anyway? But very few medical practitioners will make that leap. So I think that is a really important step in the process of rebalancing. I check my vitamin D levels, and I do that very religiously now. I go to see my integrative men's health doctor, who does a very broad range of blood tests and looking at my methylation of my B group vitamins and my whole blood chemistry. I mean, another one, and you would know this in talking to various people, it doesn't matter whether you talk to somebody about heart disease, cancer, autoimmune conditions, and of course diabetes, but the lower the insulin level, the better, which goes back to the way glucose is metabolized in the body. So bringing your blood chemistry back into balance is really important. Sleep. I mean, I have been very focused on sleep for the last 15 or more years in my practice because of my own personal experience with snoring. There was another one. I had been snoring since my 40s, and I had always dismissed it as my wife's problem, not mine, until my wife said, this is getting so bad, and this was probably in my late 40s, this is getting so bad, you're going to move into another room. And suddenly her problem became my problem because I didn't feel I was ready for that. So I did something about my snoring. And what I realized, and I always thought I slept well, I didn't think I slept badly, but boy, the difference was amazing. And then I started to do research on sleep, and the difference between, for 90% of the population, or more, I believe, we need 7 to 9 hours sleep. So I average 8 hours sleep a night. That's what we need. That's our built-in life support system, non-negotiable, should be. I was consistently sleeping 6 hours a night. Now, that was the way it was. I had kids, I'd go to bed at 12 o'clock at night, I'd wake up at 6 o'clock in the morning. This was what I was doing. That alone set me up for problems. 6 hours a night is a very interesting group of people, because people that sleep 3 to 4 hours a night know they're not getting enough sleep and score badly on every health measure. People that sleep 6 hours a night think they're getting enough sleep. I was one of those people for the first 50 years of my life, and it doesn't look good when you look at that. So sleep is another one. Fasting is another great example of dealing with cancer that I think is really useful. There's this whole process called autophagy when you fast. Autophagy is the body killing cells, picking up dead cells and killing weak cells. And so fasting is another area, meditation's another area, exercise, saunas, detoxing. So, there are all sorts of things that we can do. Fortunately, I didn't need chemo. I didn't need any other treatment. As I said, fortunately, I was fortunate to have made a good recovery. I would say a 85 to 90% recovery. And so for me, at this point, 4 years post-operatively, and I get my PSA levels checked every 6 months, they should remain undetectable. That they have been that way. And the interesting thing about PSA that I think is worth mentioning is it's not so much the absolute value. This is something else that I've explored. It's not the absolute value, like it was 3.2, which was very low. But when I reflected back on it and did the research, the fact that a year or 18 months earlier it was 1.6 and it had gone to 3.2, means the rate of acceleration was about 100%. So that was significant. The velocity of change, the rate of change can be more significant than the absolute value.
That's a great tip for men. I mean, yeah, anyone listening to this program who either themselves may have a recent diagnosis or they have a loved one in their family, these kind of little tidbits too can help. I didn't think about that one too. If you actually checked yourself, if you were concerned and you noticed that there was a change in the trend of that number, it's more maybe predictive than as you said, the absolute number falling into a certain range there.
But the nutritional part of it is a really, I think, the nutritional part, the stress part, the blood chemistry part, the sleep part. That's why I say the book is aspirational now more than ever.
And so, did you find that you delved more into something post diagnosis? So it sounds like, did you do more the nutritional route, or did you try then change even your sleep habits post diagnosis? Or even some of the other stressors? Like, I'd be interested dental wise, because that is one of the stresses. Did you have to deal with something post-diagnostic wise there?
Yeah, okay, well, nutritionally, when I say I wrote this book and in 3 months that I took off, I had been researching that for 2 years before. So and as I said, professionally, I've been exploring these things. The things that I changed were I was far more diligent about the carbohydrate level, because of that glucose, carbohydrates breaking down to glucose. It's not just the white sugar that we're talking about here. It's talking about carbohydrates that break down in sugar. So what is low carb? When you look at the research can seem confusing. People can be very dismissive of carbohydrate level in nutritional research, but you have to look to how they've defined low carb. Some of the low carb studies that are very negative put the carbohydrate level at about 150 to 200 grams of carbohydrate a day. Now, by anybody's measure who is in the low carb community, that is not low carb. So I consider low carb to be 70 grams or less, depending on your exercise level. So that's something that I definitely try to keep as a rule. The other thing that I also am far more diligent about is that I fast intermittently. I have time-restricted eating, where I would eat for a 6 to 8 hour window in a day and fast for 16 to 18 hours a day. I think when I've been interested in nutrition for all of my professional life, the one thing that has changed in the last 5 years particularly is this discovery, if you like, that perhaps we shouldn't be eating as much as we do. I know it's always been the calories in, calories out story, but that's not what we're talking about here. The fact that when in human history did we have 3 meals a day and 2 snacks in between? That just never happened. We have evolved to adapt very well to periods of hunger. We should embrace hunger. Some wonderful things happen when we get hungry. As I said, autophagy is one of them. When we start fasting and for an extended length of time, like beyond 24 hours, our body starts to clean up weak cells or cancer cells. So I think that is something that I have embraced more since I had my diagnosis. Definitely. The other thing that I've been far more conscious of is detoxing. I have now a sauna, an infrared sauna in my home, and dentistry is really not as well as the US Department of Labor continues to remind me on an annual basis now. It's not a great profession from a health perspective. And that study didn't even factor in the stress component. It's quite a stressful job, to have a person literally lie in your lap with your assistant sitting an arm's length away for 35 or 40 hours a week, and you're working in the most sensitive part of a human being while they're awake, trying to breathe and swallow and remain calm while you're doing really finicky work, it's reasonably stressful. And you're dealing with the person's stress. So that doesn't come without its effect either. So I've scaled back on my work. I mean, at this stage in my life, that's certainly something I do. Alcohol, now I would always have described, alcohol's an interesting one, to anybody who's listening to this, or Gary, if you've done this yourself, going alcohol-free for any period of time is an interesting social experiment, because you realise how ubiquitous alcohol is. It's everywhere. Every celebration, every funeral, I've had a bad day, I've had a good day, I've gone out for dinner, come over, have a drink, blah, blah, blah. It's everywhere. And I would have described myself as a social drinker in my life. And there have been times in my life when I've been too social. But now I know that I cannot tolerate alcohol. And so that is another very big thing. I do still have a drink, that's true. But compared to what I used to have, I would describe it as about a 10% of or 20% at the very most of what I used to have socially. So there's that. I'm very religious about my sleep, and I'm trying to incorporate meditation. I mean, that's an ongoing thing. Meditation's an interesting one because I have some back problems, which is, again, a family history, but also professionally. And I've always found sitting a very uncomfortable position to meditate in. I just wriggle, I just find it uncomfortable. So what I've found since my diagnosis is that being in a rest position where I lie on the floor with my feet up on the couch and a pillow under my neck, oh man, that makes the biggest difference. I mean, I find meditation to be so much easier in that functionally more comfortable position. And it's a great position to relieve stress on the back and the neck. So I love multitasking. And if I can do a great exercise for my back while I'm meditating, and I can actually meditate because I'm comfortable, physically comfortable, that's a win for me as well. So look, and I'm far more diligent. I've done many programs on my own podcast about Wi-Fi radiation, and a mobile phone does not sit on my body if I can avoid it. I certainly don't put laptops near me, and I'm trying to be as conscious of how close I am to Wi-Fi radiation as possible. I'm texting more than ever.
Yeah, and I think, also from listening to a lot of the things that you've implemented here, these are simple things in one sense. You didn't need fancy equipment, you didn't need fancy, expensive access to supplements or special dietary needs. You naturally lowered your carbohydrate intake, which I've had multiple guests on, we talked about, and you can eat a very scrumptious, tasty, low carb lifestyle if you want. Sleep well, get enough sunshine. I'd be interested there, actually, when you were talking about your vitamin D levels. Do you feel you still need to supplement with vitamin D, or do you now try to spend more time outside and multitask because you're outside, you're relaxing, you're walking?
I try, but my levels, I do need to supplement, and I still do supplement. I supplement with a vitamin D, vitamin K combo, and I'm trying to keep my levels up around 80 to 100. Now, when I'm doing really well, I'm at about 120. So, that's the score we use now. I don't even know the deciliters per millimole or something like that. I'm not sure of the scale because it's different in the US. I know you're in the UK, but in Australia, the range, ideal range, they say, is between 40 and 90. But I believe, and the integrative doctors that I've spoken to have certainly suggested that with a cancer diagnosis being in the higher end of that scale, and being 100 to 120 is not a bad thing at all. But you asked about dental as well, and I should come back to that. Look, I think when it comes to dental, there are a few things that I think are very important. One is obviously inflammation, chronic inflammation. The two most common infections known to man, woman and child occur in the mouth. That is tooth decay and gum disease, either gingivitis, which is the more superficial inflammation of the pink that you can see surrounding your teeth, and periodontitis, which is the deeper structures that hold the tooth, attach it to the jaw bone. So gingivitis, and then if it extends deeper, periodontitis, is a chronic inflammation that gingivitis affects 90% of the population over the age of 20. And periodontitis affects something like 45 to 50% of the population, and over the age of 60 or 70, that figure goes up to about 70%. So inflammation within the mouth is really important, and I have been reasonably diligent about that as a dentist. So I've kept my eye on that. But I grew up, in the 50s and 60s, so tooth decay was a problem, and I have quite a few restorations in my mouth. I did actually have a root canal filling, and it was done very well, but by technical standards. But what then happened was the tooth was weakened and it cracked, and there was a very fine crack somewhere in it because I had taken a 3D X-ray of this tooth, and it did pick up that there was some infection around it. So I had that tooth removed. I think, when you have a diagnosis of this, I'm not saying all people with cancer need their root canal fillings removed, but what I am saying is that all people with cancer should have their dental health checked out thoroughly. And by thoroughly, I mean look at the gum health, look at the periodontal health, look at decay, and if there has been a history of a lot of fillings, I think it is worthwhile having a 3D X-ray taken of the entire mouth and having it checked out very carefully, because this has been a revelation to me as a dentist over the last 5 to 10 years, that where we have taken X-rays to determine whether there was a problem or not, and we take 2D X-rays traditionally, that's what everyone's had, we would look at it and go, oh, that seems fine. There doesn't appear to be a problem. Send the patient off for a 3D X-ray, and it is so sobering as a dentist to see what we had dismissed as not being a problem potentially is a problem. And when you've had a diagnosis of cancer, and maybe, people would say a diagnosis of any serious illness, you need to eliminate the dental stress component. Now, people are often surprised when I provide them with that stress model and go, dental stress, what is that? I mean, you're only including that because you're a dentist. Well, I include it for 2 reasons. The first one is, yes, I am a dentist, so I know what I'm talking about. But the second one, I include it for anybody with a mouth who is interested in their health but has never fully connected the two. And there are many connections. And most people assess their oral health by going, nothing hurts, I think I'm okay. And if I'd assessed my prostate cancer like that, I wouldn't be sitting here talking to you today, I don't think. Pain, 95% of oral disease has no pain associated with it at all. And that is an important factor to consider. So I look at chronic inflammation. I look at that root canal, which I ended up needing to have out. The issue of how I breathe is very important. Am I a mouth breather? Am I a nasal breather? Because being a mouth breather, from an oral health perspective, from a body chemistry perspective, from a respiratory and breathing perspective, is really important. So breathing is another one of those pillars that I very much focus on as well.
And are you pro mouth taping nowadays? That seems to be quite a new trend that's growing.
Absolutely, I am, and I think that raises the issue about what's the problem with breathing through your mouth, and I think you need to do a little bit of breathing 101 here, where we say noses are for breathing, and noses warm, humidify, and filter the air before we take it into our lungs. When we breathe through our noses, there are 5 levels of filtration. The fine hair in the nose, the mucus lining the nose, the sinuses and the turbinates warm and humidify the air, the adenoids filter as well, and then the tonsils filter as well. If you breathe through your mouth, you're bypassing the first 4 and relying on your tonsils. So children with enlarged tonsils, children with recurring respiratory problems, if they're breathing through their mouth, they're not humidifying and filtering the air before they can take it into their lungs. When you breathe through your nose, 60% of the body's nitric oxide is produced in the sinuses only when you breathe through your nose. And nitric oxide is a really important body regulator. So that's a really important, and it's antimicrobial as well. If you're breathing through your nose, your mouth is drier and you're more susceptible to oral disease because of that. So taping of the mouth is a wonderful thing. I mean, I'll give you an example. I had a patient a few months ago, came in for an orthodontic opinion, a 12-year-old girl, and she was sitting, she'd filled out her history form, and we spend an hour with our new patients going through history. And in her history, it said she also suffered from enuresis, which is bedwetting. And as a 12-year-old girl, that's a problem. And she'd been to see a urologist, a neurologist, a psychologist. Her parents had spent $10,000 exploring a solution to this very serious problem. She had siblings that were 8 and 10, neither of which wet the bed. So it was even more of an issue within the house. I noticed while she was sitting there that she was sitting there with her mouth open and was really breathing at quite a high rate. And the average, ideally, apart from breathing through your nose, I believe we should be breathing at around 8 to 12 breaths per minute. She was over-breathing. And the enuresis, I said to her, when I heard that she'd been to all these other specialists and I knew about breathing, I said to her, look, I said to her parents, I think she's over-breathing at night. I think she's actually hyperventilating. And when you over-breathe, what you do is you, in an extreme form, if I over-breathe now and went, that would be hyperventilating, and eventually I'd pump all of the carbon dioxide out of my lungs and I would faint until my carbon dioxide levels were restored, and then I would wake up again. So what she was doing was she was over-breathing at night, pumping out too much carbon dioxide, and that affected body chemistry. That affects the acid-alkali balance in the body, and that causes smooth muscle to contract. So her bladder is smooth muscle. So I suggested to her that she use some micropore tape on her mouth at night. Her parents thought this was a crazy idea. Mm-hmm. There is actually a 2015 study in the Journal of Otolaryngology, Head and Neck Surgery, which I'm happy to share with you, Gary, which shows that it's actually quite an interesting effect on mild obstructive sleep apnea. But with this tape on her mouth, it calmed her breathing down. It forced her to breathe through her nose. It corrected her body chemistry, and her smooth muscle could relax instead of contract. And so in one night, she stopped wetting the bed, which was quite interesting. Now, for adults, a lot of adults don't wet the bed, but they do get up at night to go to the bathroom, and they don't often associate that with breathing. I mean, there are lots of reasons why you can get up at night to go to the bathroom. Diabetes is one of them. Enlarged prostate is another. A whole range of different reasons. But a very common reason that is often overlooked is sleep-disordered breathing. Getting up at night to go to the bathroom is often a reflection of sleep-disordered breathing. And that's something that I do religiously myself. I wear an appliance that holds my jaw slightly forward to make sure I don't snore, so it keeps my airway open. But that kept my mouth open a little bit too, so I put tape on my mouth at night. A tip for people using it, don't pull it off in the morning, because after a few days your lips will be very sore. Poke your tongue out, loosen it. It's only paper. It's micropore tape. And you will be surprised. I mean, patients have come back. I have 2 lots of patients with this, or 3 actually. One that just look at me and think, is this guy really telling me to tape my mouth? He must be crazy. I'm not doing that. Fine. Another group that give it a go and find that their nose is actually blocked, and they need to find out why that is so. And the third group that go, wow, I just couldn't believe that something as simple as this could make such a huge difference. So you can use the tape diagnostically to determine whether you have a blocked nose or not. Because as you breathe calmly through your nose, and as your body chemistry corrects itself, and as that nitric oxide is produced in the sinuses, it's nature's natural bronchodilator. So the paradox here is that a nose that you thought was blocked actually unblocks when you breathe calmly through your nose. But if you put the tape on and you go, wow, no, actually, not good, I can't breathe, this means your sinuses are inflamed. You need to find out why. It could be a household dust issue, a mold issue, a food issue, or there could be structural problems, deviated septum, enlarged polyps, or whatever. So you need to explore what that is. But yes, tape, it's really good, and there is some excellent science to support it. I actually got a letter. This was quite funny. I got a letter recently when I mentioned that at a meeting, and I got a letter from, the Australian Society of Sleep Study wrote me a letter saying I shouldn't be talking about putting tape on people's mouths. There's no evidence to support it. And I had to share with them that 2015 article, which they clearly had missed. There is evidence, and it comes also from a very long Buteyko breathing technique. I don't know whether you're familiar with that, but it's a Russian breathing technique. And putting micropore tape on at night is a part of that. Very good program.
Yeah. And it just gets me thinking too, when we're talking about the topic of stress and inflammation, how potentially for some people, it sounds like that could be pretty life-changing, stopping that chronic stress over a nighttime period. That story you shared with that little girl there is pretty phenomenal. I mean, that's life-changing for her and her family.
That is huge. In fact, whether you've had a diagnosis of prostate cancer or not, or if you want to avoid diagnoses, the pillar that is without a doubt, it's been described by Professor Matthew Walker, who's written a terrific book called Why We Sleep. He describes it as nature's built-in, non-negotiable life support system. It doesn't get much cheaper than a good night's sleep, and breathing, and that means quantity, getting enough, and quality, breathing well while you're asleep. And the changes that makes to the rest of your life, you start to make decisions about what you eat better. You start to make decisions about whether you'll exercise better. You start to make decisions about your life better when you are not tired and stressed. There's physiology behind all of that. It's not just I'll get a good night's sleep, you'll feel better. Hormone levels improve. DNA, parts of our DNA that are for the immune system get upregulated. For chronic inflammation, our immune systems improve. Inflammation is downregulated. There's so many reasons why a good night's sleep, a consistently good night's sleep, is the absolute foundation for any person's health journey.
Mm-hmm. Yeah. I've really loved this story that you've told today too, because again, I said earlier, there's so many simple things that we can do. And that's what this show's all about, is to think, okay, even if I've had a scary diagnosis that I've got cancer, I'm going to choose the route that I want, but there are other simple things I can do to support my health. And that's exactly what you've been explaining here, from nutrition to emotion to posture to dental. Sleep is a huge element to this. And I really enjoyed how you were able to lay them out, and they're so actionable again. And the mouth taping was just, maybe that's more advanced because you actually have to buy something, but still, again, that could be life-changing for someone.
That can. Look, I think the overall message that I always try and convey is that as our world is becoming increasingly more complex, and there's no question it is, the solutions are actually remarkably simple. And as you say, they're very achievable and they're not expensive. When you talk about fasting as a nutritional intervention, could it possibly get any cheaper than that? What does it cost not to eat? My one thing, warning there about fasting is, if you have been, I know your listeners probably won't, because I know you've done programs on ketogenic diets and stuff, but to go from a low-fat diet to fasting is not the right way to progress. You need to be on a low-carb diet, and explore ketosis as an experience for a few weeks at least, maybe a month or so in preparation for it, because you will find it remarkably simple doing intermittent fasting and fast, or time-restricted eating and fasting. But if you go from a low-fat diet to fasting or time-restricted eating, you're going to find it very difficult.
Yeah, that's a great tip there. So, Ron, if someone wants to maybe follow you, find out more about you, or contact you, would you recommend any social media platforms or any particular places that you would like to share for listeners?
Yeah, well, I mean, Gary, I have my own podcast called Unstress with Dr. Ron Ehrlich, and there's an app in the App Store where you can access the webinars and the e-courses that I have. Or you can just go on to drronehrlich.com, and that's DRRON, Ehrlich, EHRLICH, drronehrlich.com, and there's lots of stuff there. So, yeah, there's the podcast and there's my webpage.
Perfect. Yeah. And again, thank you so much for willing to share your personal story. I think that is going to help a lot of listeners relate and, able to give them new ideas and new inspiration. So, and you've done a great job at that, I feel.
Thanks, Gary.